would you just introduce yourselves and tell us a little bit about your son and the condition that brought him here to have cancer treatment?
Yeah, hi, my name is Santosh and it's my wife Sharine and our son Devansh, right? So Devansh was diagnosed with stage 4 high-risk neuroblastoma. Interestingly, pretty much on his 3rd birthday. He spent his 3rd birthday in hospital being diagnosed. It was almost a chance finding because he had a sort of a lump on his on top of his collarbone. And you know, after a couple of visits to the GPs, we were referred to Westmead Children's Hospital. And after a series of scans, the diagnosis was made.
And how long ago was that?
So this was about 12 months ago. So we've been about 12 months into treatment now, and we've got a couple more months to go. Okay,
and do you mind telling me just the sort of treatment your son's been having? Or I should say Spider-Man, because at the moment he is Spider-Man. So what are the treatments he's having?
So he's having what is known as the multimodal treatment. So, you know, it's the work. So we started with chemotherapy, and then we had a resection surgery to get the primary tumor out, whatever was remaining of it. Then we had, high-dose chemotherapy with stem cell rescue, also known as bone marrow transplant, followed by radiation. And then we're currently doing immunotherapy, which seems to be one of the newer sort of treatments available.
Look, the purpose of this series of videos is to share good ideas about what makes the experience of particularly radiation treatment better for the young patient and their family. And my understanding is that your son managed to have radiation without a general anaesthetic, even though you're a very young man. So what do you think made it possible for your son to have radiation treatment without a general anaesthetic? What helped you and him that much?
Yeah.
So I feel the support workers, they helped a lot, and the social workers. So support workers in the sense, like when he came in for the radiation, the support workers were there with the toys, and they did a dummy, we did a dummy run as well.
And when you say a dummy run, what do you mean?
Yeah, so
yeah,
going
Woody.
inside.
Did you have Woody?
Woody, yeah.
Yeah, we got Woody lying on the
lying on the bed, and then operating the machine, and he saw that he pressed the buttons to, you know, like how to operate it. So yeah, that helped us. I think that helped him more. Yeah.
And did it help you?
It absolutely did.
Yeah, it did.
Yeah. I think we also have been very transparent with Devansh all throughout. We sort of put a bit of effort into sort of prepping him in advance, and sort of coaching him what to expect, just so that he's very comfortable. Look, I must say that there's been really high emotional intelligence within the multidisciplinary team, which has gone a far way of not only helping us but making Devansh feel very comfortable.
Yeah.
And when you say emotional intelligence, tell me what you mean, perhaps some examples.
Just being very, very patient with kids.
Yeah.
Sort of, you know, we had our the oncologist who took care of us, Dr. Jennifer Chard, who visited us quite often before the treatment, when we were admitted in hospital having chemotherapy. So I feel that she sort of built that bridge, and, you know, sort of removed any barriers beforehand. I thought that was very nice, and sort of gave, at least I like to think, it gave Devansh a comfort level with her. Yeah. And just being very patient. The whole nursing staff and the radiation technicians, they've been very patient with us, because we had a few runs, and just being open, being, you know, very not very formal with us. I thought that really helped. Yeah. It felt like we were with friends, to be honest.
Like a family.
Yeah, and family.
Gee, that's a tribute, isn't it? Hey,
Yeah.
I mean, we're working people, having a culture where people feel like friends. That's not easy, is it?
Yeah.
How do you think they have that culture? What makes it possible?
I think it's definitely coming from the top. I'm hoping that good culture is sort of inculcated right from the senior management and the culture of the hospital and the institution, and we can see that being reflected in various levels. in the system. I thought there was, fantastic communication happening internally.
Yeah,
We didn't have to repeat ourselves a lot. So, yeah.
Oh yeah, that was fantastic. Yeah.
Devansh, can you remember having the radiation with the mask on? And
Do you remember? Yeah.
and how did you keep so still?
How was it?
Were you excited?
I have had that treatment too with the mask, and it's not easy to be really still, is it? I'm very impressed with you.
You did a good job.
I seriously am impressed because I have had the mask and it's not an easy experience. I understand that you spoke to your son through the microphone while he was in the room.
Yes.
For people who've never seen a bunker or one of these radiation LINAC machines, explain what you were doing outside to help your son inside and why you could see him in there.
We just spoke to him, like we encouraged him, like we just said like you're doing a good job, and like I think that helped him. That helped him a lot. Like both
so
of
he
us
could
were.
hear your voices.
Yeah, both of us. So
We played his favorite cartoons. What was it?
Thomas.
Thomas the Tank Engine.
the theme song.
Thomas definitely helped us.
Yeah.
So a lot of credit goes to Thomas. So I mean, they have a good system where you can play this sort of music and program it so that it's playing in the background.
Anything else that helped in the actual radiation treatment?
So a support worker was with us.
Yeah.
So,
the play therapist.
Yeah, play
Yeah.
therapist. So she came in and she was playing with him before he went inside the room, and I think that helped him a lot. Like he felt motivated, like he felt good.
Yeah.
Generally, yeah.
It strikes me, the numbers of staff are important here, aren't they? It's both their training, but it's their numbers. Why do you say that's right?
Because inside the room there were like a couple of staff inside, and I think that helped Devansh. Like he didn't feel alone, or like he didn't feel isolated in any way. So he knew like there are people around, like there are lots of people around.
So I could definitely notice the staff to patient ratio was quite nice. Because people were aware. We had I must say this very carefully, but we had right amount of attention, so that things moved on time, and that's a very important thing.
Explain, why is it important that everything's on time?
Yeah, because kids can get very cranky after a certain amount. So every kid potentially has a threshold, right, of waiting and time tolerance. So I thought the time management was very, very efficient, I must say, and that is probably because there were ample resources available.
And I just want to make it clear for people watching this that when you say that Devansh felt he was not alone when he was having his radiation treatment, the reality is he is alone, isn't he? Because no one can be in there near the radiation.
But he can hear the voice, and like he knows like people are outside the room because we explained it to him already. So he knew where we were standing and where we were looking at him, like the computers and stuff. And so I feel he felt good. Just
finally, there'll be some parents watching this who are about to embark on a treatment journey with their child. Any suggestions for them that you think might help them?
I would say just be calm, just have patience, and stay strong.
That's so interesting you say that, because my understanding is your capacity, both of you as parents, to stay calm and steady helped your son. And were you doing that consciously, holding yourselves together?
Yes.
Yeah, absolutely.
We are actually,
The way parents react to the whole situation and everything that's going on has an effect on the kids. So it is very important for parents to stay strong and be very calm, because that is very reflective on what kids pick up and how calm or supportive they are in the whole process. So I would say, look, trust your team. Feel free to be open, ask questions, but be very trusting. You've got a very professional team who look after you. But as parents, you have to do your part to support. It's a two-way street. Yeah,
it's a relationship.
So it's very important to trust your team, because it's a partnership. It's a two-way street, I'd like to think. and it works best when there is contribution from both sides, from the medical team as well as the patients and the parents. So we have a duty to support as well.
Well, I just want to say on behalf of everyone, we're so grateful to you and Devansh for coming in. Your son is still in treatment, and I know this will really help other families and other children, and I really appreciate it. So thank you so much, and we wish you well for the end of your treatment.
So thank you.
Well, look, I just want to welcome you and thank you so much for being part of this series. And we're focusing on what you do here to improve the experience for your young patients and families. Precision and accuracy is everything, isn't it, in radiation therapy? You've got a whole lot of things with you. Can you tell us, what do you do to help the young patient emotionally, but also to keep still, and if possible, to not have to use sedation, or at least not to have to use a general anaesthetic? What are you doing to help them in that way?
So similar to the adults, a fair bit of equipment's needed depending on the body area that we're treating. So if it's somewhere in the head, region, we're going to have immobilization masks. And as you can imagine, it's probably a little bit daunting for anybody really, but especially children. And so in order to get them to make that mask and wear that mask during treatment without sedation, we employ a few techniques, I guess. We have some sessions before they come for treatment.
What sort of sessions?
Well, we call them play sessions. So we've got a close relationship with the child life therapy department over at the Children's Hospital, and we can set up numerous appointments where they come and they see the department, we can play, we make masks on puppets, we decorate masks, we can play on the machine, show them how that works. I think the more they see and the more they understand what's going to happen, the more comfortable they are when they do come to have their own mask made.
And you've got a Spider-Man mask on your lap. Can you just hold it up and tell us, why have you brought that along, and the other mask as well?
So superheroes are pretty popular right now and always. So the more we sort of relate the mask that we do make with something that they can relate to, then the more likely they are to have it made without sedation.
And so what you're holding up there in your right hand, what's that?
So this is our thermoplastic mask that we make. We pop this in a hot water bath. It gets all soft and flexible, and that's what will go over the child's head if we're treating the brain region, and it clips into the bed. So it just keeps them still for treatment and in the same spot every day.
And then why have you got Spider-Man there?
So Spider-Man's just a mask that's a fun mask, I guess. So they can see that. They don't wear this for treatment, but just to relate, sort of, you can wear this one, and this one's not so much different.
So what I'm hearing is that a highly skilled technician like yourself, because you're responsible for delivering the radiation therapy to the patient, that to improve the experience for the young patient and their family, you actually have a lot of time with them, playing and getting to know them and introducing them to the space. Is that correct?
Yeah, that's probably the most important part, just to introduce them to our department, having come from the Children's Hospital where they've got such a support over to us, and just keeping that quality of care high, realising that we're not going to hurt them in any way, that they can come and they can have a little bit of fun with us. Nothing hurts them, no needles, that sort of thing. They get to see the same people every day and build, relationships with the treating staff and the radiation therapists that they do see every day.
So tell us what you've got there, and how does that help when you're working with the child and family?
So this is a booklet that's provided by one of the child life therapists that we work with over at the Children's Hospital. A lot of times before a child gets to us in their treatment, they would have encountered and built up a rapport with one of the child life therapists. So they're showing this before coming to see us, and it just goes through some of the equipment and some of the things that they may need to do over here. So just explaining that they might need to make a beanbag, we call it, just a stabilization equipment that they may need to lay on, that they do it, we can play around, we can do it with puppets, we can do it with toys, and then that they the child's going to do it then after that. So
Honestly, Laura, I've got to tell you, as a former patient who had radiation, I don't know why we don't do this with adults as well. Can you show me the beanbag and just explain more what you mean by that? Because you've got one there. And as you're getting it, I'll just explain to people that they have to keep us still, and there's many ways of keeping us still. So what's this one?
So I always refer to this as a bean bag for the children, but it's called a back bag. So it's just full of a lot of little beans. We'll mould this under their head and shoulders. If that's the area we're treating, there's other sort of shaped ones for different parts of the body. And once we've got them in a stable position that's reproducible, we will take the air out of this and it'll just form to their shape and make sure that they lay back in the same position every day when they come for treatment.
Look, thank you so much.
Okay.
My name's Tora Sibbald and I'm a clinical nurse consultant with the Western Sydney Youth Cancer Service.
And what does clinical nurse consultant mean?
So a clinical nurse consultant is a nurse expert in a specific field, and mine is in adolescent and young adult oncology.
You are a navigator and a point of contact. Explain what you mean by that and how it helps the child and family, and give me practical examples.
Often with the young people that we meet, it's their first experience in the adult healthcare system. It's a foreign land, it's a different language that's being spoken, and it's a whole new landscape. So our job is to help navigate that new world. And that looks like organising appointments, helping direct them, and in the end, helping them make their own appointments. So it's a big spectrum to get there, but that's what we're working towards. Often it's interpreting medical information as well. As I said, it's almost like a different language, the medical jargon. So we will sit with the young person and the family in consults with medical staff and help interpret that information in an age and developmentally appropriate way.
What does that mean, age and developmentally appropriate? It rolls off the tongue, but there's a lot of judgment and empathy and action to make that real, isn't there? Explain what it means.
Absolutely. So developmental milestones continue past childhood. So walking and talking in a child are important milestones, and that continues through adolescence and young adulthood. So the brain is not fully developed until about the age of 25. So in those early years, in late teens, early 20s, we're still helping to navigate normal development through the cancer experience.
We've interviewed a young person for this series, and she talked about wanting autonomy and control when she had a very extended period of cancer treatment. And I was thinking, that must be very hard, all different ages, all different cultural backgrounds. How do you what can you actually do to give a patient and the family autonomy and control?
So I think, as I said earlier, being present for those big medical discussions, so that as the nurse consultant, I've got a good understanding of what the options are, what the decisions are, and what the potential decisions this young person might have to make. Then it's important to follow up with the young person on their own to get a good understanding of what they took away from that information. So asking questions, being very curious, reading cues.
What sort of cues?
So that can be physical cues, that could be a word that's dropped in every now and again that triggers a bit of interest, and you might ask for clarification. So I think being curious is a really important part of the process. And then establishing, do they understand for example, if there's a medical decision that needs to be made, do they understand what the options are? Do they understand the implications of those options? So for example, end of life, we're getting towards end of life decision making. Do they continue down the path of experimental treatments or clinical trials, or do they go down the path of palliative care?
Now, nothing's more sensitive than what you've just said. At what age would you discuss such an issue with the child as well as the family and the medical team?
I think ideally in an ideal world, everybody is on the same page and everybody's involved in those discussions, but it is a very case-by-case situation. I think knowing the family well and being there right at the beginning really helps, because you've developed that rapport over time to be able to navigate those tricky decisions with them.
When I first spoke to you, you said our job is to help people get through treatment as unscathed as possible. What did you mean? How do we get scathed, if there's such a word?
I don't think it's possible to go through cancer treatment without some scars. It's a traumatic experience. Any life-threatening illness is traumatic. So there are things in our control as health professionals and things that aren't in our control. So the things we can control are things like appointment times, consolidating appointments, getting them all on the one day if we can, rather than getting them in 3 days in a row for appointments. It sounds like practical, insignificant things, but they really have an impact. So it means potentially that the young person is able to go to their school assembly, is able to go to their graduation with their peers, and they are big milestones. And what we're working towards is, as I said, unscathed as possible, but as well-developed young person as we can by the end of it, despite going through this horrendous ordeal.
Thank you.
My name's Jennifer Chard. I'm a radiation oncologist. I work at the Crown Princess Mary Cancer Centre at Westmead, and I work in the Paediatric team and with the Youth Cancer Services team.
And so what sort of patients do you treat, and what sort of treatment do you offer?
So I also have an adult practice, but my main game is treating children and young people aged 0 to 25 years. And my specialty is radiation oncology, so that's treating tumours with X-ray treatment, and I also specialise in brachytherapy, which is another type of radiation treatment where we actually put a radiation source right next to a tumour, and that's really good for some types of cancers.
What's been interesting talking to members of your team is that what you describe is a highly technical medical intervention, and yet there's been a very strong focus on the human relationships between the team members and between the team members and the family and the children. So I want to hear about what you've done to build a culture of care and communication and support. Tell us about that, and what's that got to do with being treated for cancer?
In some ways, it's straightforward to treat someone for cancer and just deliver the treatment, but to do it well and to have people and families who feel well and can go on afterwards, that's a much more difficult thing. And in fact, the whole medical community is only just getting their heads around how to do that and how to do it better.
Why is it hard for a family to feel well while their child's being treated?
I think it's such a traumatic experience to go through, to have a sick child. We don't have a framework to put that in. I mean, sick adults and adults with cancer is something that we're used to in some respects, but sick children and sick young people, that's really hard for people to deal with. From an emotional setting, from a young person who may just be starting off their life in a new job or with a new family, it's just not what they expect, and cancer is completely out of the blue. So the things that we're doing here to try and make that better for patients and families, certainly there's the technical expertise, and I think here we are all technical experts in our field with additional training to be able to deliver the care that we have. But the things that are much harder to measure are the things that we are able to, and the services we're able to wrap around the patients and their families.
Tell us about the services you offer and the sort of different staff you have so that you can try and deal with that emotional challenge of cancer.
I have a luxury here that I have a whole range of staff around me that I can call on to deal with different aspects of patient care. For example, if I need a psychologist that's expert in treating teenagers, I've got one. If I need a social worker for looking after patients and their families and their siblings, I've got one. I've got access to a school support service network. I've got access to a vocational and educational support officer, as well as the nursing care and the radiotherapy care we've got here. So I feel that I've got access to anything that I could possibly need to support a family, including things that we might not even have thought of that the family brings to us that they'd actually like help with. I think we're really good at problem solving on the run and dealing with situations that are outside the normal medical setting that we might get taught about, say, at medical school.
What I'm hearing from you is that if we're going to really offer a better experience in psychological or emotional terms to children and their parents around cancer, you've got to have a multidisciplinary team, and you've got to have enough staff, and you've got to have enough time.
Exactly. So having enough time is really important in establishing rapport with patients and their families in order to get them through treatment, as well as having enough time for each one of those members of the team to get to know the patient and their family, to be able to help them in the best way.
We've met a family and a young boy who's just turned 4, who's still currently in treatment. He's had radiation without needing a general anaesthetic. From a purely physical health point of view, why is it important to try and, if we can, reduce the use of general anaesthesia as a means of keeping a child still during radiation therapy?
Well, general anaesthetic every day is something that we do frequently if we need to, and of course if we've got very young children we have to. It's the only way to get them through treatment. But if you can avoid it, it means you avoid fasting overnight and having grumpy children in the morning, and you can be flexible with the time you have treatment. You don't have to do it that first thing in the day. And of course, whilst we know that it's safe, there are some factors that we'd like to avoid general anaesthetics if we at all possibly could. So if we can avoid them, we can. And often patients and parents themselves manage a lot better if they don't have to deal with the extra stress of a general anaesthetic every day.
What can you do to nurture the well-being of the team? Because the harsh reality of cancer is that not every child will be well.
That's true, and that's a reality that staff working in paediatric oncology and young adult oncology do have to deal with. I am very fortunate that we have a team setting here where we all support each other and can acknowledge that we will each have tough days for whatever reason. It's unusual that we all have a tough day at the same time, but that we have a space where we can be open and talk to each other and discuss some of the really difficult things that we see on a day-to-day basis.
Is there anything else you'd offer to other cancer team members watching this that you've learnt about supporting each other so that you can attract and retain really good team members?
I think creating a culture where everyone feels that their opinion is valued and that can come with a new idea, even if it's not a good one, even if it doesn't pan out. So it's a safe space to be your best self and to do your best work and to take risks and make the most of the opportunities that we have. Not everywhere is like that. I think sometimes we're on edge in our departments, but in my team, I feel like I can bring an idea and discuss it with everyone and truly have it talked through. And ultimately, I think that benefits our patients because we can be more creative. We can offer treatments in radiotherapy that we couldn't do otherwise because I've got a team that's willing to push the boundaries, discuss new ideas, and create new things.
Well, look, I just want to say thank you so much for welcoming us into your treatment area, into your hospital, in the middle of a pandemic when all this is going on. It's just really been fantastic to talk to you and your team members. Thank you.
Thank you.